So I just want to now introduce Jo Casey, and Jo is chair of the Society, sorry, not the Society of Tissue Viability, it's Legs Matter, Jo. Jo is a podiatrist and senior research assistant at the University of Southampton. And Jo, you're going to update folks on the campaign, aren't you? So over to you. Thank you.
Thank you. Yeah, so my name is Jo Casey. I'm a podiatrist and Royal College of Podiatry member representation on the Legs Matter Coalition. I'm standing up here on behalf of everybody in the coalition because we'd like to share with you an update on our current campaign in what is actually Legs Matter Week this week. So we're really excited to be here and sharing this with you. I'm going to call it harm. I'm just going to leave that word there, harm. How does that sit with you? We believe in Legs Matter that inadequate lower limb care is harm, and it's wasting public funds and it's harming patients. And it didn't take that particular stamp or word very easily. It sort of sat quite difficult. It was quite difficult for us to swallow that word to begin with as a coalition. But then the more we thought about it, the more we thought, no, we do have to actually talk about this. This is a real problem. So we called out the word harm. Who are we to call out this word in such a big way? Well, we're a coalition of about 7 member organisations, and we sit, as Sarah quite rightly said, under the governance of the Society of Tissue Viability. We are their foot and leg arm, if you like, of their umbrella. So we sit underneath them. We've got several member organisations that sit with us, patient partners, co-opted members, and of course we wouldn't be here without our industry partners, and affiliate sponsors as well. Here are some of our industry partners that you can see. They've been kindly sharing the message of Legs Matter this week, as they do every day across the calendar. And we're really pleased to work with them in our campaign. So what is Legs Matter about? Well, we've got like a mission statement really to raise awareness, to educate, and then to provide action. And so that's the sort of trio that kind of is our building blocks, if you like, to all of our sort of campaigns that we've had over the last, since 2018. And it's really so that we can start to see change. We're always on the move. We're always trying to make change and deliver and provide education that supports raising awareness and change action in the delivery of care to our patients with foot and lower limb conditions. So going to our campaign, what does harm look like to you? Have you seen or witnessed harm? Now, it doesn't mean to suggest that it was deliberate, because that's, not as healthcare professionals, that's not what we're in, in our roles for. But it's usually sort of indirect harm or harm that's happened through systematic sort of failings. And that's what we want to try and call out. But harm ultimately is physical harm. It can be emotional harm, and it can be psychological harm to us as clinicians, as well as to our patients. And to the system and to the wider public health. So, we're not really talking about small elements here. We're talking about a really big area of harm in foot and lower limb. And that's why it's really important for us to continue on this harm campaign. If you've been following us for a while, you'll know that we started this harm campaign in 2022. Under actually Sarah, I believe, we started this campaign. And then Alison and myself joined in as chair after Sarah, and we built the 10-point plan with the coalition team and a 3-tiered strategy where we looked at early intervention, safe administration, and advanced disease management. The reason we picked the 3 different tiers is that we do normally provide a lot of education around advanced disease management, but it's often too late at that stage. So we started to think within the coalition, how can we try and prevent harm? How can we prevent disease processes? So we sort of started to think about early intervention. What can we do to get in early to prevent this, this public health disaster that we're seeing happening at the moment? So we started to think about, we're going to try and sort of infiltrate into community settings. We started working with local pharmacists. We've been working with care homes. We've been working out in the communities. And then we sort of trying to hybridise that with safe administration. So you may have seen our Legs Matter Roadshow that we have, where we tried to encourage people to apply early intervention compression to sort of help support chronic edema and venous insufficiency. But all before people started to develop real complex problems like leg ulceration, leaky legs, pain. So we tried to get in early. But what we realised with this particular strategy, although we were getting traction on it, we had a lot more work to do. And this is where our new campaign started to come in. This was our 10-point plan that you may have seen in our last sort of wave of a push, where we acknowledged it as harm, we called it out. We wanted to try and encourage people to use the right products at the right time. We didn't want people to be afraid to escalate. And we wanted to change the system. And all of our strategy linked to one of these 10 points on this plan. But we need to do more, as I've said. We don't want people to be afraid to escalate the problem, and we want to change the system, and we want to actively change the system. So, of course, we're looking here at points 8, 9, and 10. And so we then started to think, what can we really do to make a big difference? So our campaign for 2025 to 2027 is all about using your voice by speaking up, patients speaking up, carers, professionals, because we can all help drive the change that's urgently needed. It's not happening fast enough, and we need to find leaders to help make the change. It's a continued focus, of course, on our harm campaign, but actually what we're hoping to do is be more strategic about how we can affect that systemic change. So we've designed 2 goals. The first goal is to get health and social care commissioners to act on harm by requiring healthcare providers to incorporate lower limb best practice recommendations. The second one is to get more health and social care professionals involved in tackling the harm crisis. So the first one is to actually start digging beneath the system. How can we get people, the patient safety influencers, the people that change the system at the core of healthcare to incorporate best practice recommendations? And then how can we encourage other people to be involved in supporting these changes and to raise awareness, educate, and create action? And we're doing this by goal 1 is we're going to be highlighting the national and international guidance that provides the blueprints for excellence in lower limb care. We're not reinventing a wheel here. It's out there. We know it's out there because we've seen excellent projects that have been put together all over the UK, and we want to try and highlight those. But one of the things we're going to really do is we're going to collect data, because data, obviously, as we all know, get good data, and that's actually a solid foundation to actually calling out harm. And we're going to collect the data by asking for a freedom of information survey across as many health and social care commissioners as we can. So we've got a set of survey questions that we're going to be putting forward to these health and social care commissioners sitting in ICSs, sitting in nursing homes, to ask them, are you utilising what we currently know as best practice? What is actually happening out there? Because as soon as we can understand what's happening in the UK, we can possibly help to change and influence. But also, of course, we'll be calling out the fact that, well, if you haven't got that access to care and you know it's best practice, or it's sitting within the NICE recommendations, why aren't you doing that? So we're starting to get a little bit, let's make change. So how can we really do this with a bit of punch? We're seeking support from patient advocacy groups across the 4 nations to highlight issues of gaps in lower limb care. That's what we're hoping to do as well. So, really getting people on board to help us. So asking patients, asking people that have received care, what are you finding that's not happening for you? And then, of course, we're heading into those ICSs to ask those really big, tough questions. And the aim really is for patients to have quicker access to assessment and appropriate care. That's really what we're after. It's just making that change that is best practice. Goal 2 is getting the healthcare professional to work with us. And that's a healthcare professional, whether you are a carer, whether you are an allied healthcare professional, a nurse, a medic, a surgeon. We want everybody to be involved in this campaign to help push anybody that's got an interest in foot and lower limb care. And to do that, we've created a Champions programme. We'd like people to join up to the Champions programme if they believe in our campaign and sort of pledge to work with us. Part of the Champions programme is that we'll then host events for our champions, so coordinate a network of people together, all like-minded, to try and, how can we work together? How can we make links? How can we best support each other? And we'd like to create some events, networks with those champions. So we want to ask really our champions to consider what's your one thing that you would like to make change, and what is it that you're doing out there to try and support change? So raising awareness, action and education. because it's a serious message. Patient safety is a serious message. Sue's story, which you'll see on our website, absolutely breaks my heart every time I see it. Because Sue, with her leaky legs, as we so call it, wrapped kitchen roll around her legs, and after 2 hours she'd used the entire roll because she hadn't had the correct therapy. That's not good enough. That's harm. Imagine this was you. This is Annie's story. I was the only patient on the ward who still had both my legs. She was sitting on a vascular ward, Annie. She'd had an acute situation. She was the only one on the ward. The woman next to her had gone down for surgery, and she heard the surgeon through those tiny curtains, of course, that we have on hospital wards, which, you know, is one of the environmental things that happens. But she heard that the person that went down before her wasn't able to save their leg. And she just sat there listening. She'd never been so scared in all her life. We need to stop this. We need to call it out. The problem's not going away. Whether we think we're making change, it's not going away. I only heard last week when I attended the Manchester conference that they've made great inroads in certain areas, and there's other areas where they need to make better inroads. So great programs like that still need to make change, still need to be pushed forward, because amputations are still happening, and a lot of it can be prevented. Are you the best clinician? Are you the best? Do you have the best environment, and do you have the best practice? As healthcare professionals, we all stand up to clinical governance, clinical standards, professional standards, and we need to make sure that we are encompassing quality assurance, quality improvement, and we need to reduce risk and incidents by creating a decent management system. So, you know, have a think. How can you try and make change? How can you prevent harm by thinking about your clinical governance? What systems do you have in place? If we can work together, we can actually prolong life and promote health. But we need to do it as organised efforts as a society, as Aitchison said. He said, if we come together, that's why it's so great that the society hosts us. That's so great that you're all here listening to this to try and think, okay, there's a group trying to push. I won't reinvent my wheel my end. I'll work with them because actually we're all working together. So we need to push this forward, and that's the art and science of preventing disease. What we're hoping from this campaign in the next 2 years is that you'll share one thing. Say it, share it, change it. So what's the one thing that you would like to change? I've heard all sorts of things this week, from, you know, palpating pulses, using your Doppler, going to ABPI for a vascular assessment, the 3 Ps. I've heard some people talking about making sure that you clean your feet as often as you wash your face. You know, people check with a mirror under your heels, ask friends and family to check for you, report things early. There's lots of things that we might have. What's your one thing? Post it, share it with us. Contact your local patient advocacy group. Ask them, what would you like to see different? And amplify our campaign. Change starts with one voice. It could be your voice in your area. So work with us, say it, share it, change it. It all starts here. Legs Matter Week is promoting it, but actually this is a 2-year campaign and we need your support every single step of the way. And your voice could change everything. If you want to be involved with us, please do think about signing up to becoming a Legs Matter champion. We want to get as many people on board to lead charge, prevent disease and end harm in lower limb care. So pledge with me. I'm a Legs Matter champion. I think legs and feet. I act early. I speak up. I know what to look for: swelling, wounds that won't heal, skin that's breaking down. I know what to do, when to escalate in order to avoid harm. I understand that legs and feet are often ignored and that needs change. I share knowledge. I raise awareness. I make leg and foot health part of my every conversation because better leg and foot care starts with all of us. If that's you and that resonated with you, please sign up. We've got a lovely pack that we'd like to send you to help you raise awareness, to feel part of our team, and we'd like to provide you with a network to build these bridges and support better lower limb care. What's your one thing? Have a think. See it, share it, change it. You can do it any which way you like. You can share it on a poster placard. You can share it verbally. I've done many outtakes this week with this particular one. I will share them all on social media. It's never easy being on social media, but the more we can push, the more we can share it, share it, share it. Say it, share it, change it. Thanks very much. Thanks, Sarah.
Thanks, Joe. That was brilliant. Yeah, lots to think about, folks. So please do take up some of these requests. Think about your role in this, and certainly, become a Legs Matter champion. Fantastic campaign. You're doing amazing, Joe. So on behalf of the Society particularly, thank you for all hard work from the coalition. But yeah, great campaign. Thanks again.
Thanks, Sarah.